Donna is from the Deafblind Scotland, and she is going to give us a talk tonight and gives an insight into what her role within the organisation is. So, without any further ado, if I can hand over to Donna, and I look forward to hearing what you've got to share with us.
Yeah,
Thank you.
thank you, Joyce. So my name's Donna Finlayson, and I work for Deafblind Scotland as their business development lead. But I thought it might be interesting for you to share with the group my Rotary connections. So I was a Rotary actor in Glasgow for a number of years when I was a student, and then following on from that, I was a Rotary ambassadorial scholar from 2009 to 2011. So yeah, it seems like so long ago. And for my ambassadorial year, I went to Lund in Sweden and I studied international development and management. And that was focused on humanitarian causes. And this has been quite pinnacle in my career because every place that I've worked for does have a humanitarian background to it. So without further ado, I'll just share our presentation here. So we're Deafblind Scotland, and deaf blindness is obviously it's the two conditions, but at Deafblind Scotland we see it as a distinct disability in its own right. But first of all, it's just a kind of exercise we've got here. So if you can imagine living in a world where you can't see or hear, and yet you're expected to navigate life independently, and that's a reality for many people that we support at Deafblind Scotland. So there are many ways that people can become deafblind. So it could be genetic conditions such as Usher syndrome. So that's where a child is born with Usher syndrome or Charge syndrome. So the child is born with hearing and with sight. But over time, that will deteriorate and it will deteriorate much more rapidly than a older age would. So, for example, some of my friends and colleagues are now blind. So it can be quite common to go blind maybe around the age of 30 to 40, 50, quite maybe having quite serious degenerative conditions. But it is in some respects manageable to an extent. For example, if you keep a healthy diet, not smoking, diabetes can be a risk as well. Also, there's cases where deaf blindness can be caused through premature birth, and there's a number of illnesses such as meningitis and MMR. But with measles, mumps, and rubella and meningitis with medical progression, the instances of children and young people, especially receiving these conditions, some adults as well, is much less than what it was many years ago. But we do have some people that we support that as a child they did have MMR and or meningitis. We do have a number of people who suffer a traumatic injury, so their deaf blindness is immediate. So and sometimes there's very rare genetic conditions where somebody can just go immediately blind and deaf. So, but that in those cases, it's very rare. So in Scotland, an estimated 1% of the population will be deaf blind. So it's about 34,000 people. But we know that this condition is larger than that 1% because that's the people that have been diagnosed with this. But we do have an aging population in Scotland, so we do have people that are deafblind through degenerative conditions with natural aging process. And also, people unfortunately can go deaf and blind through illegal drug consumption. And yeah, so this is just a couple of the types of deaf blindness. So we've got retinitis pigmentosa. So that is where you see, so that's kind of, this image maybe doesn't show it as well, but it's that one is where, yeah, you can see dots at the bottom of your eye. So it makes it quite difficult to see. So sometimes you might see older, like that's quite a common condition with older people is speckled sight really, but it can be very limiting. So for people who are blind, for people who are deaf or have significant deafness, we do sort of medical science has come on, and there are ways in which people who are deaf-blind can now hear because of the technology of hearing aids. So there's different options. So there's cochlear implants, and that would be for people that have profound hearing loss. And also people, so an example of that would be that you're struggling to follow conversation. And sometimes that would be suitable if someone has a functional auditory nerve. So there's a nerve within their ear that's damaged, so they could use that. Um, Also, we've got the Baha bone anchored hearing aid. Um, and this hearing is caused by sound being unable to reach your inner ear. So it picks up the sound by vibrating bones near your ear. So it could be that somebody's maybe not got those bones, or yeah, and there's even like very small parts of the ear that are almost feather-like, and they basically do this action. But if that's damaged, it can, affect your hearing. So it's not a one case fits all when it comes to hearing aids. So they need to be properly assessed and implemented. And on a daily basis, we receive complex referrals from hospitals, GPs, and community health workers of people who have been affected by deaf blindness and have no or very limited forms of communication. So, for example, if somebody suddenly becomes deaf blind in hospital, then the hospital would probably contact us and we would be able to go out and provide support. So this is our building here. So it was established in 2017, and it was proudly funded by our members of the deafblind community. So we didn't receive any statutory funding for it. So everyone in the deafblind community is very pleased of that. Our board is also made up of 50% of people who are deafblind. So we're very pleased about that too. So just looking at vision, so a society in which deafblind people have the permanent support and recognition necessary to be equal citizens. So this is just our vision really for Deafblind Scotland. We enable deafblind people to take their rightful place in their local communities, ensuring their voices are heard across society. And our purpose is to offer empowering support to people with dual sensory loss, and especially those that are in transition. So we've got a number of people who might have just one sensory loss, but we do know that with somebody with one sensory loss is at more risk of developing a secondary sensory loss. So we do rehabilitative work, and where there is degeneration in one of the senses, we do support people to build up their skills, like have the ability to read Braille, because it's much easier to learn Braille as a sighted person, or learn sign language as well, whilst you've got both senses. We also work in advancing public education and understanding of deafblindness to facilitate a more inclusive society. And we do this like today at this Rotary Club, but we're also quite targeted in our work. So we'll go out to auditory clinics, opticians, to really find people who are at risk of these conditions and to help train up the staff, and create more awareness and kind of maybe often targeting older populations. And our purpose is also promoting equality and the human rights of deaf-blind people to ensure they have an opportunity to live equal lives. And we provide like a number of activities in our services. So we offer a number of services. So we've got a guide communicator service, and we offer 50,000 hours a year. So a guide communicator is someone who is similar to a support worker, but they're highly qualified, because our support workers are need to be qualified to BSL level 6. So there's 6 levels in British Sign Language. Most people are around level 3 and above, but that's 6 years of training. So we do have highly qualified staff, and at the moment we're trying to campaign for guide communicators to be recognised in their own right as communication experts, but it would involve being part of a different regulatory body and not just automatically being taken under the health and social care practice. So we also offer rehabilitation support. So that can be maybe if someone's been in hospital, we offer long cane training, independent living skills, and navigation support. So here we've got someone in the kitchen, but what we can do is offer like bump stickers onto cookers. We can provide audio cookers. We've got, white goods that can speak out. And recently we've also kindly received a grant of AI meta glasses. So this is particularly helpful for people because they can receive audio description of their environment. So we've had one lady that said that she tried the meta glasses, which are made by Ray-Ban. So they cost £200 per set, but they're absolutely fantastic. So we've had one lady who said that she can now get up in the morning, look towards her cabinet, and the glasses describe to her and say, "Hi, your jumper is to the left of your drawer." So she's now able to get dressed independently. So it just shows you how much technology is moving on. We also have long canes, and for a deaf-blind person, the canes are white and red. So that's how you would always know in the community if someone is not only blind, but they're also deaf-blind. And even now, the canes have AI feedback in them. So, but some members say that it can be overwhelming, but it could be something that maybe younger generations will adopt. Um, Yes, and we've also got digital champions. We're training people in digital technology, for example, using like Amazon devices, so that they can say, "Amazon, buy my shopping." Yeah, and troubleshooting. So we've got specialist rehabilitation workers that help us with that. We also offer health and wellbeing services. So we've got counselling and mental health interventions. We offer telephone calls because when people are going through the transition from single sensory loss to dual sensory loss, it can be, as you could imagine, it can be really quite traumatic for people. And there are some conditions, such as Charles Bonnet syndrome, where people can receive hallucinations of images, but the hallucinations are not very pleasant. So it could be of somebody that they remember in their past life, or sometimes it can be like monsters and things, but just you could just imagine yourself trying to cope with that. So we offer counselling as well. At our centre in Kirkintilloch, we also offer a number of activity programmes that are aimed at creating community connection and reducing isolation and helping people to connect with new friends. And we offer 400 hours of that a month. So examples of that are cycling groups, arts and crafts, Scrabble, and bushcraft. And we also have uniquely, our counselling services are unique in that the counsellor is trained in British Sign Language. So that makes it a unique service for people we support. We also offer welfare rights, which is particularly important for people to make sure that the people that we support are get their benefits and their entitlements are maximised. And often we find that around 50% of our clients, they don't have the full maximisation. So it just shows you how isolated they can be. We also offer support to carers in terms of welfare rights and respite breaks. We also have a regular newsletter, and this newsletter is published in Braille and Moon, which is a type of Braille. So Moon is a language that if you are sighted and then go blind, then that is a type of language that can be useful to learn. And we also have audio description, which we send out to all of our members. So we have over 400 members across Scotland, so they'll all receive a newsletter. We also do the football news and we do lottery results as well. And we have guide communicators that are even so talented and they're up to BSL level 6 and probably beyond that, that they can actually communicate a football match on someone's hand, which is just fantastic. So imagine like going to Ibrox or, Parkhead and the game is being described to you on your hand. Like that's how quick the guide communicators are. So yep. We also have we have our peer leadership program, which is called Right to Dream and Touching More Lives. And this is in relation to training. So some of our board members and our members would go out into the community and describe to people what deafblindness is like and how what challenges they've had in their life and how they've overcome these. And that can be particularly inspirational for the people that we support and sometimes often give hope as well. Um, Training program, deafblindness with sensory equality, communication skills, BSL. Yeah, so we teach BSL, tactile, so tactile sign language as well, which is different. So with tactile, so there's deafblind manual, which is using your hand to spell out the alphabet. And then with tactile sign language, more of the body is used. So it would be the forearms as well, generally, but maybe other parts of the body too. So that would be for people who are completely deafblind that would receive tactile. And when you see it in action, it's absolutely amazing. And then there's just one of our guide communicate sorry, actually one of our members. He was our former trainer, but now he's going to become a board member. So that's John there. And I'll probably come back to this so that I can show you tactile. So we have a bad link. So this is what it can be like for somebody who has gone through a journey with us at Deafblind Scotland. So Ron attended audiology. The doctor realised he also has an eye condition. Ron's given a Deafblind Scotland leaflet. He contacts Deafblind Scotland. He's referred for a membership assessment and to the welfare rights team. He works with the welfare rights team and realised he's got complex communication needs, tactile British Sign Language. And most deaf-blind people are unaware of their rights, their welfare rights. So the team would identify for someone like this what he can access and the benefits that he can receive, such as SDS. And then this gives the person the ability to choose and to pay for the way that they would like support. So Ron can now access our guide communicator service. And we have service with and then it could be like maybe like cane training or just whatever their needs are. And then with that connection, we can then connect that person onto all the services that we offer, such as BSL Cafe, digital support, just whatever they need. So that tends to be the journey of people that we support at Deafblind Scotland. So, and then this is just what we need support with. So IT advice to support our rehabilitation program. So these are always the skills that we're looking for in the community skills that can support our health and well-being activities. So for example, like volunteers. Sometimes people can nominate us as charity for the year, like if they're in a workplace, which can be quite helpful. Inclusion of Deafblind Scotland within corporate social responsibilities, corporate volunteer opportunities, and in-kind and basic. So sometimes we can also receive volunteers in terms of anything that we're needing done within our workplace, such as joinery or anything like that. And this is just like a bit of a link about Deafblind Scotland and my contact details there. And that is me. So if anyone has any questions.
Hi, thanks, Donna. That was a lot of information for us to ponder over it, and I'm quite sure there'll be quite a few questions. My only sort of question was, obviously there's a lot of uh, internal support to your clients. Do you have quite a big staff membership then to be able to cover this?
Yes, so we do have about 70 members of staff in total.
That is a lot. Yeah.
Yes, and our charity is considered a small to medium-sized charity.
Uh-huh.
So we have, just to give you a scale of the organisation, so we've got a scale of our income is around 1.5 million currently.
Right.
And the organisation was established originally in 1989, just based by the needs of the community, and it's grown from there. So originally we were associated with Deafblind UK, but we became an independent body over time. Yeah.
Okay. Yeah. I mean that amount of staff and the income that you're generating, I would imagine it is still quite tight. Yeah.
Yes.
Yeah, I would
So
imagine so.
So, as you're aware, we often don't get full cost recovery
Uh-huh.
in terms of what it actually costs to have guide communicators.
Yeah.
We are contracted to provide guide communication. So that has been a success for the charity over the years because that's something that we didn't have previously.
Yeah.
And we are one of the sole, I definitely know in Scotland, we are the only service in Scotland that provides services for commission services for people who are deaf and blind. We're the
Mhm.
only provider of that. So we're very unique in what we can offer, and very specialised, and we will try and support people no matter how rural it is. So we do have guide communicators that work in Aberdeen, and we can have maybe 3 or 4 people within that region. I think up to 8. We've got 8 members in Aberdeen at the moment, but we will provide communication staff there. So it can just be maybe 1 or 2 members that are working in that region of the country. We do have a
Yeah.
concentration of workers in the central belt, but yeah.
Yeah, it's just I would imagine that amount of staff. There's a huge amount of support within the organisation for the staff. You know, it's not a case of
Yeah.
saying you've got that staff. It's about managing them and all of that that
Mhm.
goes along with that.
Yes.
So
Yeah.
it is quite a big task, I think, for
Yes.
the organisation. So, does
Mhm.
anybody have any other questions that they would like to ask on it? Bill?
Donna, that was uh, interesting, but beyond interesting, and awareness. Is enough being done in towns and cities to really cope with people's disabilities? I know I use the Glasgow subway quite a lot, and
Mhm.
it's great to see a member of staff waiting for the tube to come in and then escort somebody out or in. Is
Yes.
that happening more and more, or is there still a lot more to do?
There is still a lot more to do and creating awareness around that. So it could be that a person who is deafblind not might not be aware that there is a service that is offered by ScotRail or whoever it may be. If it's the subway, SPT, but we actually have just recently won a grant award from the Motability Foundation, who are funding a rehabilitative program where we will do exactly that. So we will meet our member at their house and then travel with them to their destination. As part of training, and then that person can become comfortable and then build their confidence so they can they can travel independently. And then they're made aware of the services that are available. So they would know then to contact like the station master and they would have a number for that and the process of it. But some of our members, especially those that are blind, they would it's absolutely amazing how they're able to do it, but some of our members can count the steps from their front door all the way to the train station or the bus stop, and they know exactly and what hazards are in the way and if they need to go right or left at one point. So that our training sessions can help them with all those aspects.
Yeah, it sounds fascinating.
Yeah,
Unbelievable.
especially using a cane at
Yeah.
a railway station as well, because they'll be able to feel the edge of the line really, and then there's all those bumps, and then under the traffic cones as well. There's also a little ball which you can touch, and then when that vibrates, that's when you know that it's green and you can walk. So, yeah.
I just can't imagine how awful it must be, how traumatic it must be for people to all of a sudden to go blind and deaf. You must be so isolated. I just can't picture it at all. But and it seems
Yes.
that a lot of the things you do are for people maybe who are, maybe you would have a little bit of sight left, a little bit of hearing left, but if you've got absolutely nothing, it must be just purely down to the tactile thing.
Yes.
And I don't know if you saw that Chris McCauley, the comedian guy who was on Strictly. He was on sort of, they'd given him a pair of these glasses, talking, to describe his environment, and he was basically saying for a blind person that could be that would be life changing. Just the ability would give him to just walk out more freely. So I suppose things happening all the time, but it seems a tremendous job that you're doing that's maybe not covered within the sort of the health service enough.
Yes, yeah. And recently, only in 2025, we received recognition from the Scottish Government that deafblindness should be considered a disability in itself, in its own right, because at the moment it's not, which then means our members, if they have to go to the hospital, they have to see auditory, and then they have to go to optical. So it's like standing in two queues. So they could be there the whole day, or have to go on different days. So that can be quite a lot for them. So, and with the distinction of deaf blindness as well, we hope that the services will also increase, and it can just affect everything. So like benefits, access to benefits and things. There's a lot, if it's recognised as a distinct condition, it brings a lot of additional benefits to people's lives.
Donna, it's been, as I said earlier, it's been fascinating to listen to you. I think this is one thing that an e-club can do that other clubs can't do. You meet people like yourself and meet them through business or through other situations, and ask them to come and talk to us, because it's amazing. And also, I don't know if you give a talk, or your members give any talks to Rotary clubs. I'll certainly be writing to you and asking if you'd like to be put onto our speakers list for our district, Scotland South.
Thank you.
And I think so. We see getting Paul has been recording this. That goes onto our YouTube site. Copy goes to you. It's another way in which we are trying to help you. So thank you very much indeed. And on behalf of the club, can I ask them to give you the usual Zoom thanks? Thank you.
Thank you.